This is my client Allison, who is a nurse, and she injured her coccyx when she was 21 and fell back onto a low-lying chair and struck the coccyx. And then when she was 33, she gave birth to a large baby, and that traumatized the coccyx. And she believes, as do I, that the coccyx was shifted backwards. And we treated her today. It's a rare presentation for a coccyx to be pushed backwards, and so I wanted to capture this on film. Mm-hmm. And she did present with a torsional pattern of her sacrum. So her sacrum was rotated on an oblique axis and side bent. And the coccyx was side bent to the left, and we corrected both of those things. I had her do a self-correction for the sacrum, and she knows how to do that on her own, so she'll be able to self-manage that. The treatment for the coccyx did require my manual pressure, first on the right side of the ligaments and then on the left side of the coccyx, 5 minutes each. And after we achieved symmetry, we still felt like it was no longer side bent, but it was then shifted backwards. Was still shifted backwards. And so we used a simple sacral dowel, and we had her lean against the wall with this dowel capturing the coccyx. So the dowel was placed like this, and there's the tip of the coccyx, and she was bent forward, and so she was leaning forward to traction with this foam being against the wall, which would traction it inferiorly and anteriorly. So it was inferior gliding to gap the sacrococcygeal joint, and then it was applying a posterior to anterior pressure. And so I thought I would just have her give us some feedback. Mm-hmm. So your thoughts, any comments?
I think laying on my stomach and having the pressure on either side of the coccyx on those ligaments was, while painful, spot on as far as where the pain is originating from. It's from like pulling that coccyx to the wrong side, so that felt the best. I can see where using the foam against the wall to straighten out my my sacrum, that will help, because I could feel a difference right after doing that. And then I'll sit on the dowel, or I'll lean on the dowel against the wall. Yeah.
For the direct treatment on the coccyx.
Yeah. And it feels different now. It doesn't feel painful right now. So I'm happy.
And sitting would be the best way to test it. Correct?
Yes. And you know, for sure, with my hour drive, this will
You'll be able to
test.
Indeed. And so I'll see you back in about 2 weeks. Mm-hmm. And you'll do some Kegel exercises daily, at least 100 reps of that.
Okay.
And try and build up some strength in the pelvic floor, so that'll augment stability of that coccyx.
Okay.
And I think by doing the self-treatment daily, that should help. Also advise you to put some pain cream around that area and ice it at least daily. Okay. And we certainly want to counteract this chronic pain syndrome. Mm-hmm. And so it's been with you
9 years.
Yeah. Mm-hmm. Yeah. And your pain gets to an 8 in the evening?
It can, yeah. I would say I'm kind of baseline a 5 at night, but if it's a bad night, I'm an 8, and I'm laying on the ground. I'm not even able to sit and watch TV. So
yeah. Mm-hmm. Well, very good. I sure hope we help. And please emphasize I wasn't too forceful when I pushed on the coccyx.
It was the right stretch at the right spot.
Good. Because I just don't like provoking pain, and it was pretty hypersensitive.
Yeah, absolutely.
Very good. Well, I'm hopeful, and I hope that this turns out to be a success story.
Me too.
Thanks for your help.
Thank you.